Hi, I'm Dr. Joe Pusateri. I'm talking today about heel pain and plantar fasciitis. Plantar fasciitis is a very common problem. Roughly about 1 out of every 4 new patients that come into a podiatrist office do have this problem. Plantar fasciitis is a irritation of the ligament on the bottom portion of the foot called the plantar fascia. It starts at the base of the heel and goes towards the base of the toes. It is made up into 3 bands, a medial, central, and lateral band. And typically the most common portion of it to be affected is the inside portion or the medial band. This tends to be more of an overuse injury. You think of the bottom of the foot more like a rubber band. And every time you take a step, the band elongates, and as you take your foot off the ground, it comes back together. This repetition causes stress along the inside portion of that band, which will cause micro tearing, which will bring on inflammation, pain, swelling, and so on. The way we typically treat this will be immobilization, steroid injections, anti-inflammatories, and then eventually stretching. If conservative treatment does fail, there are other options. They are surgical. There's 2 ways one can approach it. One is an open plantar fasciotomy, where we make an incision along the inside portion of the heel, actually expose the plantar fascia medial band, and then incise that with instrumentation. The other, a little bit more technically complicated, is done with a arthroscopy, where we make a small incision on the inside of the heel and then a small incision on the outside of the heel, utilize a camera to visualize the band in all 3 sections, where then we can also utilize the curved blade, which will release the tension along the medial aspect of that band, thus reducing the stress and tension on the band, which will alleviate the patient's pain. Typically, a patient is back in sneakers within 2 to 3 weeks of this operation and can resume full activity as they are comfortable.